All
All
right,
right. Good
starting
morning,
round.
everyone. Let's
Okay,
let's get going.
All righty.
awesome. Okay, so after receiving mediocre care this semester, a college student is admitted to the hospital following a suicide attempt. The client states, "I'm such a failure. I should have done better. It's not enough to be average." According to Freud's psychoanalytical theory, which structure of the client's personality would the nurse identify as predominant? I feel like it might be, hold on.
Maybe super ego.
I was thinking ego or super ego.
Yeah.
Everyone's going with that one. I'm looking right now. I got Erickson's, Freud's.
Hmm.
Damn it.
Well, let's see. Can't tolerate frustration like ability something.
It's not it because it is more like totally subconscious.
Right.
Yeah, I was thinking definitely like below the surface.
Self is not one of them. That's not part of
I'm
it.
opening another blackboard so I can pull that one up too. It's
Okay,
under
well, I'm confused
under
actually
mod one.
because for super ego,
Oh, you got it, Michelle. You
no,
got
no, no,
it.
no, I'm because it's saying like it says may include guilt, a sense of pride, or both.
I
So,
think it's super
you know,
ego. Yeah.
All right, we're
yeah,
gonna
because he's
Because
like, I'm such a failure.
yes. Because super
But
ego is almost like the expectations that society puts on you,
I say,
whereas ego is more like parental, I think.
Yeah,
okay.
I agree.
So I mean, I would say because it can't be self because self is not one of the theories. It
yeah,
is more. It's totally subconscious. Ego is more like when the first. It's more like conscious, but it's I don't know.
it's like just below the surface. So what it says like it resides in like the conscious, the
Yeah.
preconscious, and like unconscious. So like
So for sure, it's not ID. All right, let's get that
it's
No,
one.
it's
no.
not.
Mm-mm.
Sure,
Not
So
that
it. It's
we're
not
down
self.
to three: ego, self, or super ego.
No, no, no. It's down to two. It's just
Good.
ego or super ego.
Okay, and develops respect, moral component, personality. The
Yeah,
consistent
super ego because it's more like the morals, like what
may
society
include guilt,
expectations.
a sense of pride, or both. Uh,
I think super
with
ego.
super
I
ego,
think
is that what everyone says?
Yeah.
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 Okay. All right.
All right, cool. Next.
All right. Next.
In planning a care plan for a senior citizen, which of Erickson's developmental stages should the nurse anticipate for the client to be within? So Erickson.
Eric.
Well, senior citizen, that's like obviously much later in life.
Mm.
So 65 and older. I guess you could do 55 to death. So it's at, yeah, 60 to death. Jesus, that's so
Is
depressing.
it integrity versus
Yeah. Integrity
despair?
versus despair.
Yeah.
Cool.
Do you agree, Paulo?
I I
It's
I was looking for the definition of the. Hold on. Thank you. Oh yeah, because it's talking about like possible like when the integrity versus despair is like having regrets, right? That's what that
Yeah,
is.
it's like
yeah,
they
like you're
look
looking
back on
back
their
over your
life.
life and do you think like you did good or do you have like regrets kind of?
Yeah, no, that definitely. So integrity versus despair.
Cool.
All right,
Um,
number three.
26 month old, so that's a 2-year-old. That would be the anal
Right. I think so.
hmm.
Mhm.
of the psychosocial development.
Yeah.
How
Is it
old are two, you said?
So it's 26 month old, so that's 2 years and 2 months,
Oh, okay, yeah.
which is in the 1.5 to 3 year range. And because
like
it's
Yeah,
psychosocial,
beginning
it's
is
Freud's stages of development.
yeah, sources of satisfaction,
yeah.
attention of feces. Okay, yeah,
Okay,
I'm gonna go with anal.
Yeah.
cool.
Because the main thing is the toilet training
Yeah.
at that age.
So psychosexual is Eric. Oh, that's Freud's.
Freud. Mhm.
Mm.
Oh.
Patient says things like, "I never know the answers, and my opinion doesn't count."
I would feel like either shame and doubt or the inferiority.
I think it's industry versus inferiority.
Okay. Yeah, I don't yeah, wait. Is this Erickson's?
That's what I'm looking for right now.
Hmm.
Yes, it's Erickson's.
Yeah.
Mm-hmm.
Yeah, I'm sure. So which one are we going with for that one?
I think industry versus inferiority.
my opinion doesn't count.
Initiative versus guilt. Yeah, I mean, unsuccessful resolution crisis. I can't read as well as the other kids in my class. I'm just dumb. You know, I never know the answers. My opinion doesn't count.
Okay, so which one are we going with?
I
Wait,
think
which one is that? So, where does that fall under? Sorry.
Um,
Find it.
it's Erickson. It's 6 to 12 age.
Mhm.
It's industry versus inferiority. So it's yeah.
So we're gonna assume the patient is 6 to 12. Is that what we're talking about?
Yeah,
here?
that's why I'm just.
I mean, no, that's just like when it develops, like that, like when you
Oh,
enter
gotcha.
into
Oh,
that,
I see.
you know what I mean?
Difficulty resolving. Okay.
Mhm.
Mhm.
Gotcha.
And like at the bottom, like on that little thing, like read
Yeah.
the example, like the the
Mhm.
quote.
No, I agree. Sorry, I didn't realize we were talking about resolving that.
You're
Okay.
No, you're
Okay,
okay.
so
So
it'll
industry,
be
yeah, industry versus inferior.
Okay. Industry versus majority. Okay. Number 5, after receiving mediocre grades that eliminated her from the honor society, a college student is admitted to the hospital following a suicide attempt. The client's father and sister revealed that the client was severely punished throughout her life by her mother when she did not perform to expectations. According to People, a nurse who provides the client with praise following a small accomplishment is serving which of the following roles? Oh,
Surrogate.
Yeah, I would say this is surrogate.
you're pretty confident with that, Michelle. So you sure?
Yeah.
Okay.
I agree.
You know what? I actually had a hard time. I couldn't find any of like the peplau or
Oh,
I think it
peplu.
was you had to go to chapter 15, I think,
Oh.
Or more okay, because yeah,
or even more of it. Yeah.
chapter 2 kind of just talks about who they are.
Mm-hmm.
Like, yeah. Okay. All right. So we go with
Should we Google it just to make sure? Or
Yeah, you can check. I mean, I feel pretty confident it's
I
surrogate,
think it's surrogate. Yeah.
okay.
only because the nurse is kind of stepping in for the mother figure who,
Right.
you know,
Oh yeah. Okay, I get that.
so she's
Yeah.
acting almost like, I don't want to say a surrogate mother,
Well,
but
didn't she say that in class too? Or I feel like somebody said that
Oh,
when they said you're almost a surrogate, like you have to be a mother.
okay.
Expectations. Did she say that, or was that Dr. Magoo? Magoo.
Well,
Yeah.
because when you think about it, she wouldn't be like, I mean, I guess she is a technical expert, the nurse, but in this role, like she's not really playing the role of a technical expert by, providing praise. She's not really being a leader. I mean, I guess she's being a leader in some ways, but some ways not, right?
Yeah.
And a resource person, honestly, I don't really understand what that's supposed to mean.
Yeah, I don't know.
I feel like it's surrogate. What do you guys think?
Well, I looked her up. I mean, surrogate under her this website here for her serving as a substitute for another such as a parent or a sibling, but it doesn't
Yeah.
say specifically from her.
Well, yeah, you don't have, it's not from birth. It's more just as like you're
What
providing.
definition of it?
Yeah, like you're not like like a surrogate mother. You're just more like a surrogate in terms of like you're providing the praise.
Oh,
Where someone else, like a parental figure, did not provide the praise.
okay.
Or, you know.
I'm good with that.
Okay, cool.
All right.
Oh, here's this guy again. A nurse influenced by Palpu's interpersonal theory works with anxious, withdrawn patient. Intervention should focus on.
Is it enhancing the patient's interaction with others?
Yeah, I was thinking either that or changing the patient's self-concept.
Yeah, because like the whole purpose was to promote interventions to lower anxiety with the aim of improving patients' abilities to think and function at more satisfactory levels.
Okay.
So
Yeah,
it's not,
because
she's not, you're not rewarding their desired behavior.
yeah, I was just gonna say it's not like a reward system. It's not like, you do
Mhm.
this and then like you get this. Um, because that will just make them more anxious. They're like, oh God, like if I don't do it, then and then they feel pressured and then it's like not.
Mhm. Yeah, it's not, and it wouldn't be administer medications that like defeats the whole purpose.
Hmm.
So
Yeah,
enhancing the
especially
patient's
it's also like interpersonal theory, and it, like this is the only one that's like within the self.
So which one are we going with?
B.
So would it be changing the patient's self-concept or
Oh, I'm silly. I thought you were agreeing with me.
no, I'm just confused because if she's promoting the with the aim of improving patients' abilities to think and function at more satisfactory levels, I feel like it would be enhancing the patient's interactions with others, right?
Oh,
Because if she's
really?
anxious and withdrawn, then we would want her to interact more with others to like social. I think you're definitely right.
Mm-mm. Okay.
Wait, so which one?
The enhancing the patient's interactions with others, as Sydney said,
Oh,
Yeah, I think
okay.
that one.
because the patient's anxious and withdrawn, so she would benefit from that.
Right, because it can help them develop like social connections and like reduce feeling of like isolation.
Hmm.
Oh, okay,
So
okay.
sorry guys, I was reading people and they go more in depth on chapter 15 about her.
That yeah,
Isn't that what you said, Peyton?
yeah. I was just yeah.
That's where it's at. So, my goodness. Okay, so all right. So which one are we going for that one?
The last one.
The last one, enhancing the patient's interactions with others. We can go through at the end too, and like just check we all have the same answers.
Okay. Okay.
All right, cool. 7.
A patient would benefit from therapy in which peers as well as staff have a voice in determining patient privileges and psychoeducational topics. Which approach would be best?
I'm pretty sure that's the Miley U one because it's
Therapy.
support, structure, validation, involvement, and containment.
Yeah.
And like that like all of those, like the structure helps both, the head of therapy, the staff and the clients or clients, oh my God, patients. Um,
19.
Cognitive therapy, that's like where was this one?
So
Yeah, that's like that, like it said like all or nothing
structure and emotional
thinking,
recovery.
overgeneralization.
Takes natural occurring events in the environment and uses them as learning opportunities for patients. A consistent routine and structure maintained to provide predictability and trust.
No, I agree. I'd say it's
I
the
think it is the
milieu
Well,
therapy
yeah.
because the whole purpose is to provide a safe physical surroundings and supportive therapist for both patients and staff.
Okay.
Mhm.
Cognitive therapy, short-term dynamic therapy. Yeah, no. Okay.
Oh, the assessment phase of the nursing process is the next one.
Oh, sorry.
So
Oh, the assessment phase. I have that written down somewhere. Where is it?
It again.
Oh, yeah, you construct that, you get your data, you assess their mental status, there's a psych assessment, physical history interviews, and then there's like a little rating scale. What is this asking? Which action conducted is not a means of gathering data?
Is it explaining the purpose?
Josh,
A good, yeah, that's not part of it.
assessment phase. So
This
assessment
is in lesson 1.2
mhm.
and
where they talk about it. So
seven.
come on, load.
Assessment phase. There we are. Mhm.
Yeah, and then like you verify the debt. Yeah, there's no being like Yeah, here, client's medical records,
So I think it
history.
would be the first one. Which one did you guys, which
I
one did
thought
you
it was
Explaining-
explaining the purpose.
Yeah.
purpose?
Yeah.
We're talking about number 8, right?
Yeah.
Yeah,
Hmm. Okay, this whatever. Okay.
What do you
because
think, Kyle? You
Paolo,
think it's the first one?
I'm looking social spiritual assessment, mental. I'm just reading what it says right here. Review of system.
I mean, if you think about it, like, I mean,
Do you have anybody
like,
got their book? It's in 113. Establish rapport, obtain understanding of the current problem, review patient physical status, assess for risk factors, perform mental status, assess social status, identify mutual goals for treatment, formulate a plan of care, document data in retrievable format. So, I mean, I'll put whatever everyone agrees on. So,
it's what part is not part of it. So you didn't read anything that said what it
yeah,
said.
okay.
Yeah.
So, okay. So, observing the client's interaction with their family is one of them.
Yeah, because
Yeah,
you think
because
about it, you're gathering data while you're looking at them, you know?
Okay. Okay.
Which statement about a psychiatric assessment is accurate? It's not the first one.
mm-mm.
It's not the third one.
Yeah, yeah,
No, I think it's the second one.
Second
I
one
think
was
so. I think so
Because you
too.
have to consider the biological, psychological, and social aspects, you know, as well, like cultural aspects
That's
when you're
yeah, that's
conducting a
everything.
psychiatric assessment.
Yeah, everything pertains to it.
And subjective reports rather than objective that's not.
I agree.
Mhm.
So the second one,
Yes.
Wait, what is this? The psychosocial?
number
Oh, no,
9.
No,
Number
the
9.
psychiatric assessment provides a thorough
got it.
diagnostic overview.
Yeah.
Which is not an example of an appropriate goal for number 10.
Well, goals are
First
always
one.
supposed to be measurable, attainable, like the SMART goals.
Yep.
Right.
Which one is
So client will feel happier by
Yeah,
discharge,
that's
maybe.
because how do you measure and define happiness?
Exactly.
rated 0 to 10? I mean,
All the other ones make way more sense. You know,
Within,
there's
within
one
1
every-
week by the end of session. Within
mhm, 2 days.
or 3 tears that cause anger but end of session, initiation. Yeah, I will go with the first one. Everyone agree?
I agree.
Feel
Okay.
happier. Yeah.
All right.
Okay.
11. Which
Statement
best
of
describes
intervention.
nursing interventions?
probably the first one. Or wait, let me.
Well, it's not the second one.
I think it's the third. That makes the most sense to me.
I agree. The third one.
Although they are independent nursing actions, nursing interventions occur in concert with overall treatment team goals.
Yeah, I like that because they occur. Yeah,
Yeah, it touches on everyone else. It's like a circle of the goal of the team, each of
or
special.
are they independent actions? Yeah.
I'm confused. I don't know about this one.
So you think
I'm
nursing intervention is autonomous, and it's independent away from what the team's goal is? Like it's specifically just for the nurse?
oh, hey, what's happening?
Well, I think they are independent actions because they're initiated by the nurse based on
Yeah, not
assessment
the
of-
physician
yeah.
or like because I mean, there's different. Every team kind of has their own goals that they want to see, like the speech language pathologist,
So
physical therapist.
Hmm.
outcomes, diagnosis, evaluation, interventions.
Diagnosis involves
So-
identification.
The nurse is generally contact with the patient. Nurse also tends to
Wait,
be.
what is wrong with me?
I mean, it's not answer. I mean, it's on page 118. Registered nurse interventions. Okay, so everyone doesn't. Everyone thinks it's the first one then.
For which one?
No,
Um,
I think it's the third one.
Oh,
Yeah, I think it's the third one because it's independent.
yeah.
When you think about it, like every team, every healthcare team, like
Oh, I
members of the
thought we
team.
changed it to the first one. My bad. Yeah,
No.
yeah. Okay.
Well, here's my thing. Like, if so, as a physical therapist, like you have different goals, right? You want the patient to be ambulating, etc. As the nurse, like you want the patient to, for example, let's say the last one, we want them to identify 3 triggers that cause anger by the end of like a session, right? Those are independent, like from the physical therapist's goals,
Right.
from the physicians, like the psychiatric goals.
Okay. So 11 is the third from the top.
Yeah, like I said, we can go at the end. I think we should just go through just to make sure we all have the same answers, and we can talk through some of them.
Okay. Fair enough.
Okay, which scope of practice is reserved for advanced practice psychiatry?
Psychotherapy.
Agreed.
Okay.
What did you guys say?
Psychotherapy can
Sorry.
only be done by psychiatric nurse practitioners.
Yeah, it's right here in 119. Psychotherapy. Yeah. All right.
Michelle, you good with that?
Yeah, sorry, my computer's not charging and I'm
Oh,
trying to
you're
figure
okay.
out what is happening. I feel like my
Right.
like power went
13.
out or something.
Adolescent hospitalized after a violent physical outburst tells the nurse, I'm going to kill my father, but you can't tell anyone. Select the nurse's best response.
Probably I'm obligated to share.
Yeah, isn't that one of the
Yes.
mandated reporter?
Yeah,
Because
there's
nurses are
certain
mandated
things-
reporter.
Yeah.
Right? I mean, but at the same time, do you want to be therapeutic about it?
Plus will make it too long. Well, definitely not the second one.
No. Well,
No, you don't want to do that.
it's not the first two.
You yeah,
I
definitely.
don't think it should be the third one because you're like, oh, you should share that with your like psychiatrist. It's like, oh, like don't bother me with
Almost
that. Like,
dismissive, yes.
yeah, or it's like you're leaving too much time. Like, what if like they do it?
Mm.
You know what I
Like, what
mean?
if
And you're
the psychiatrist doesn't act on it,
yeah, or like like if they're like, oh, like you
or
should
they don't share it?
yeah, they might not. Someone could be like, you should tell that to your psychiatrist, and they're like, yeah, we'll do. And then,
So it's gonna be the fourth.
I think so.
I would say
I'm
the fourth
obligated
one,
to
yeah.
share that information with the treatment team.
Yes.
Okay. Which component reflects elements of a mental status examination? Oh,
The third one.
Hmm. I
Periods.
was just gonna say, I had that also written down somewhere.
Appearance, behavior, speech, mood.
oh yes.
And-
Okay. I agree with that one.
Cool.
Okay, a
Next.
family member of a patient with delusions of persecution asks.
Persecution.
most-
Sorry.
Oh my God.
It's okay.
Sorry.
I
She's
refuse,
going on
Sorry.
5 hours of sleep. It's okay.
I refuse to read any more questions.
No, you're good. You're good.
That's so embarrassing. Oh my God.
All right, let's go. All right, want me to finish it? Oh my
Please.
gosh, it will end in 10 minutes.
That's what I mean. We're gonna have to start up another one.
Yeah,
It's
yeah.
okay.
Do you guys got
But-
the second right?
Yeah.
Yeah.
We'll keep going until this one's about to end.
Yeah. Are there any circumstances under which the treatment team is justified in violating a patient's right to confidentiality? The nurse should reply that confidentiality may be breached under no circumstances
Mm-mm.
at the discretion of the psychiatrist when questions are asked by law enforcement if the patient threatens the life of another person. I'm gonna go with that one.
I would say the
Yeah.
fourth one.
The fourth
It's not.
one?
Yeah. If the patient threatens the life of another like person or patient,
Yeah, that is the most serious.
because at law enforcement, like you still have to maintain HIPAA. Like they have to provide warrants and they
Oh,
have to provide actual proof.
Mhm.
yeah.
The psychiatrists, they're under HIPAA too. They can't just
Uh-huh.
breach.
All right.
I agree.
All right, next one.
All right, a nurse in an inpatient psychiatric unit is observing client activity, talking with clients, and striving to maintain a therapeutic environment in collaboration with other healthcare providers. Which part of the implementation step of the nursing process does this reflect?
The milieu.
Yeah, I feel like it might be that again, but
No, I think it's
yeah. Oh,
Oh,
well,
definitely. By definition of that,
because that's one of the parts of the implementation step, the milieu.
clients strive to maintain their
wait, what's wrong with me? Oh,
Well,
two.
providers. Okay.
Wait, so what? Wait. Oh, okay, yeah.
Because the goal is to, once again, like the milieu, like you want to have a collaboration with other staff and like therapists and stuff.
I agree.
Next, a patient states, I'm not worth anything. I have negative thoughts about myself. I want to go to sleep and never wake up. Which nursing intervention has the highest priority? Number one, self-esteem building activities. Number two, anxiety self-control measures. Number three, sleep enhancement activities. Or number four, suicide precautions.
I think 4.
Number four.
Yeah.
Everybody? Yes?
Yeah.
Okay.
It's kind of straightforward.
I know, I was gonna say.
Or is that a nurse intervention? Suicide precautions?
I think so.
Yeah, because
Is it? Okay.
remember, when she was talking in class and she said like you can like bring someone or even like or no, what I don't know what I'm talking about. She might have said it in class, but like in clinical like slash class, like we learned like there's 2 different like admission forms, like voluntary and like involuntary. So
Yeah.
like it could be like a nursing intervention because like if you're a nurse or like a mandated reporter or like whatever, you know what I mean? Like that could be
Mhm.
like a suicide precaution, that you do.
Yeah. Well,
But
there
if
is a
they're like,
nursing diagnosis risk for suicide, so it makes sense.
yeah,
All right. Moving on. 18,
Case management.
which reflects the purpose of case management. Oh, good gosh.
Does it maintain a balance between cost and quality of care?
I think that one makes the most sense because it's
Mhm.
not like it's not a medical welfare system. They're not just gonna like give you money for your, stuff like randomly. The point of it in general, like, is not to
To
ensure
help
that they all
patients,
have
really.
medical coverage. Yeah, it's
But that's kind of broad. So
Definition here is case management is defined as a healthcare process in which a professional helps a patient or client develop a plan that coordinates and integrates the support services that the patient needs to optimize the healthcare and psychosocial possible goals and outcomes.
I would say the
so
third one fits that then.
yeah.
There we go. Agreed. Moving on.
Awesome.
Which viewpoint of an Asian American family will most affect decision making about care? Ooh,
Mm.
me, that's my people.
Tell us what it is, Paolo.
It's not the
The
last
father
two.
is an authority figure.
Yeah,
I thought that too.
that's
Seriously, is it my dad's way or the highway?
Okay.
All right, 20. Someone sorry. Someone read 20.
I'm dead. All right. A Latin American woman refuses to participate in an assertiveness training group in an inpatient psychiatric unit, which of the following reflects a possible cultural explanation for her choice?
It's not the second one.
All that's in chapter 5.
Because Latin Americans are not, aggressive. Like they're not all highly emotional and aggressive.
I'm just trying to think. Would that be Western, Eastern, or indigenous culture?
That would be Western.
I was
What-
gonna say, yeah.
right? Okay.
Yeah, I wouldn't say it's religious either.
Mm-mm.
But maybe is it the second one? But I don't feel like
It actually, yeah, it actually might be the second one,
Patient,
but
her choice.
I don't know. I feel like it might be assertiveness.
That's what I was thinking too. Is it's
Mm.
the third one? Because it's not a
Yeah,
lack
but,
of
like-
future orientation.
I don't know, dude. I feel like Latin American women they're good with being assertive.
Okay, so let's do a
I'm gonna
process
look it up.
elimination. It's not the first one, right?
Right.
No, I don't see that yet.
Okay, is it the second one?
Oh,
Could be.
High
you
level
guys.
personality and aggression are common in this culture, making it difficult for the client to master these skills. So that's a possibility. And the third one, assertiveness techniques may not align with the client's definition of female
But I feel
role.
like if it can't be the second one because if high levels of emotionality and aggressiveness are common in this culture, then wouldn't
That's just
Yeah.
an
then
assumption.
wouldn't it already be like wouldn't it already be easy if we're assuming that, right? To master those skills, like assertiveness,
Right. I think
if
it's
they're highly emotional, if we're assuming that they're highly emotional and aggressive.
Okay, you guys, I found that people said it's number 3, and it's because it says the nurse should identify that the Latin American woman refuses to participate in an assertiveness training group reflected or it may be affected by the Latin American culture definition of the female role. Latin America
Yes.
places
Okay.
a high value on family, which is male dominant.
Mhm.
And the father usually possesses the ultimate authority.
So it's
So
the third one?
yeah,
Okay.
I mean, at least that's what I found.
No, I agree with that.
I
Because
agree.
the second
Yeah,
one
no, I
kind of contradicts itself.
Yeah.
All right.
The
Cool.
fourth one, I would question 21, I would
Mhm.
say is countertransference.
Yeah, I
Because
also
that's
had
where the healthcare worker is like referring to unconscious feelings towards the
Yeah.
patient.
Mhm.
yeah, redirection of the therapist's feeling towards the client.
Hmm.
Okay.
Cool.
Good.
Next, 22.
You're very confident with that one, Payne. So I'm gonna
Yeah.
go.
That one
Oh, I agree. Yeah.
Yeah, yeah.
that one I have it right in my notes.
All right,
Yeah,
what-
Mr. Confident Paolo.
Why is the study what? Okay. I'm gonna get
Go
you.
ahead, go ahead.
Why is the study of culture so important for psychiatric nurses in the United States?
The third one.
Third one.
Yeah,
I'm going with the third.
Yeah.
Okay.
This Zoom's about to end. We got like a minute, just so you guys know.
Okay.
We could do like one more. And then
let's try and do one
We'll cut
more.
it.
This is a long one.
Hospice
We can go to
nurses
24.
care for 4 culturally diverse patients, each of whom has advanced cancer. Which patients will most likely wish to engage actively in end-of-life planning? End-of-life planning. Some
Generation.
Western.
I would
No.
say the fourth generation, right?
I
Or
agree.
no, would it be the
Uh,
Native American? Because
Yeah, they're considered indigenous, right?
yes,
Deep relation to nature.
and they're forest rangers, so they're a lot more, closely associated in nature. So they might view like end of life as like something natural to accept, just to kind of, I don't want to say go with it, but
Are you guys like thinking this is a wait, let me read this question again. Sorry, ignore me.
We got less than a minute, so whatever. If it cuts off, I'm gonna
That's
we'll-
fine. I'm gonna open up in the email right now.
Let me just end this. Okay.
Okay.
We
yeah,
can-
I'm enjoying that one.
There we go.